Good afternoon and welcome to the Midday News. Here's what we have in the bulletin. Summer classes disrupted at Hydel following fire. Opposition raises concern over Delta variant of COVID-19. And later in sports, J3's boss not going to the Olympics. I'm O'Shane Masters. Here are the details. Face-to-face summer classes were halted at the Hydel High School in St. Catherine after a section of a facility caught fire this morning. It's understood that the fire started in the school's main office. Groundsmen at the school say they saw fire coming from the building sometime after 7 o'clock and made an alarm. 4 units from Spanish Town and Portmore fire stations responded to the blaze. The school's principal, Samara Salmon, says several files and computers have been destroyed.
And what we would have started this year for this year's process is that registration was being done online. So it is pretty much going back to persons who were in the system before or who would have left before that we would now have to focus on. But I guess we have some time to get that done. We would have been able to get some things out, but right now it is just relocation. We have other offices on the compound that can facilitate the operation, so we have to just do some relocation. So we know that by Monday everything will continue as is, registrations, things like that.
In the meantime, Ms. Salmon is assuring parents and students that things will be in place by the time school reopens in September.
The students and the family, the parents body know Hydel. We just ask everybody to continue to pray. It's going to take a lot of work, but we will have everything ready. It is about education, and it's just putting in the work to get things up and going for school in September. We still have some time, so we'll see how that goes.
138 new COVID-19 cases were recorded in the last 24 hours from 945 tests. The country's case count now stands at 51,542. This brings the positivity rate to 13.8%. 4 new deaths were recorded, pushing the death toll to 1,167. One of the deaths was previously under investigation. Meanwhile, 122 people have been hospitalized with a respiratory illness. 16 are critically ill. There are 3,248 active cases. Opposition spokesman on health, Dr. Maurice Guy, believes the current increase in COVID cases could be the result of the Delta variant. Speaking in Parliament yesterday, Dr. Guy argued that the Delta variant is already on the island. Sandy Williams reports.
COVID-19 samples collected in April, May, and early June did not show the presence of the Delta variant, which is a highly transmissible strain of the virus. However, Prime Minister Andrew Holness in Parliament yesterday said the government is awaiting results for recent samples to determine if the variant is already in the country. But opposition spokesman on health, Dr. Maurice Guy, believes the Delta variant is already in Jamaica.
So for almost for the 3.5 weeks of June left, and for the 3 weeks in July so far, it could very well be that those samples that come back will show that Delta is here. I am of the view it's here. In fact, I am of the view too that it is the reason where we're having the death rates that we are having in terms of the weekly mortality rate.
There has been an increase in transmission of COVID-19. Up to Wednesday, the country's positivity rate stood at 16.1%, up from Tuesday's 6.5%. Westmoreland and Hanover have recorded the highest number per capita for COVID-19 cases.
Although a particular event occurred about 7 weeks ago, 6-7 weeks ago, which was Mocha Fest, the reality is that we are wondering we are wondering whether that has any bearing on what we are seeing now in terms of the numbers. And if it is an indication of what may happen in terms of other events to happen across the entire island.
Dr. Guy is urging the government to speed up the process to acquire the genome sequencing machine, which can identify the various strains of COVID-19. The Prime Minister said the machine is expected to arrive in the island in a few weeks. In the meantime, Dr. Guy is stressing the need for people to take personal responsibility in observing the safety protocols.
There also was another clip, Prime Minister, that showed a particular leader at a particular party, and it was only that leader who had on a mask. In as much as the country's opening to these events, there has to be the responsibility, and you did indicate, Prime Minister, the personal responsibility that people have to have in terms of their own protection and protecting themselves from others.
Sandy Williams, TVJ News.
Meanwhile, local public health experts are raising alarm that the third COVID wave is imminent. They're calling on the government to urgently put measures in place to prevent a major outbreak. Shamela Pullen reports.
Prime Minister Andrew Holness on Tuesday warned Jamaicans that the country could be in the early stages of a third wave of COVID-19. As such, Professor of Public Health at the University of the West Indies, Mona, Peter Figueroa, says, based on the reproductive rate of 1.1, immediate measures are needed.
It's probably the Delta variant, and that can be very swift with an increase in cases. We've gone over one. We need measures immediately. And they should start with measures in Westmoreland and Hanover. I don't think they should wait any longer. Because, if you study the last surge carefully, one could argue that if action was taken a few weeks earlier, we probably could have prevented a couple hundred deaths.
He further warned against taking a watch-and-wait approach as the consequences will be severe.
When you look at the data, when you start to get an increase in cases, it rises rapidly. And if you look internationally at those countries that are far better vaccinated than us, they are seeing a surge. In the UK, they're seeing a massive surge, but their vaccination coverage is around 70%. Our coverage is 6%, and therefore we can't wait for the cases to surge, because you get the cases surging, in its wake you get the hospitalizations and the severe cases, and within 3 weeks you're going to get an increase in deaths.
Similar views have also been expressed by Associate Professor at the School of Public Health at the University of Technology, Dr. Alveston Bailey. He's also worried that some citizens are still not taking the virus seriously, while some have become complacent.
We also must remember that only about 5% of the populace is fully vaccinated, and only about 10% have received one dose. Therefore, we are extremely vulnerable. Now, the emergence of 4 COVID variants of concern, namely Alpha, Beta, Gamma, and Delta, and 4 COVID variants of interest, Eta, Iota, Kappa, and Lambda, reminds us that we are still in the throes of a major pandemic with worldwide consequences.
Shamela Pullen, TVJ News.
Meanwhile, Professor Bailey says some vaccines are not effective against the new strains of the coronavirus.
In Israel, the effectiveness of the Pfizer vaccine is waning, with antibody titers in some patients falling from 90 to 64%. Therefore, this is not the time to let our guards down. Despite our best expectations, human beings are risk takers in the pursuit of pleasure or in any goal that they deem desirable.
Dr. Bailey says too many persons are becoming less vigilant and complacent with the COVID-19 measures, and that needs to change. And it's time for a break. Stay with us. More stories when we return. Welcome back to the Midday News. Senior members of the Jamaica Defense Force and Constabulary Force are asking the public for patience as work to reduce major crimes within the zones of special operations continue. Parliament earlier this week voted to extend the ZOZOs. The senior law enforcement officials appeared before the Internal and External Committee of Parliament yesterday.
Almost 4 years on, and Denham Town continues to pose a challenge to the security forces. Since it was declared a zone of special operations ZOSO, major crimes are down by 41%. Deputy Commissioner of Police Clifford Blake says he's confident that the enhanced security measure is working, but there have been several shootings in the zone, some of them just a stone's throw away from the security checkpoint. DCP Blake says Denhamtown poses a unique challenge.
A significant number of the main players who are operating in that zone, they are either behind bars, and in some cases at least 4 members fled the island and are elsewhere since the zone was enforced.
Of concern is the level of investigation being done to successfully convict criminals, some of whom reportedly order hits even in police custody.
The problem will never solve if you can't really stop those from perpetuating the crimes. I know of at least one where that continues as we speak.
We have significantly reduced the capacity of some of these members to communicate from behind bars, in that the use of cell phones, your ability to get cell phones, has been cauterized because of these technology. And if we have been following the media, some famous names have been removed from some institutions and placed elsewhere. And since that, they are off Facebook, Instagram, they are off phones, communication.
Meanwhile, the police continue to tout the success of the Zoso in Mount Salem, St. James, but DCP Blake says there's still more work to be done in the area. The committee was also told that the Zoso in Augusttown and Greenwich Town are now in the hold phase, while in Norwood, it's in the clear phase.
At this point, we are satisfied that Mount Salem is heading in that right direction, but it is not at that point, given these indicators that we want to use and measure it, that it is fully there as yet. But as I said, it's the first one, and we are analyzing these tools to make a determination at when we can leave, so we can use it to assess future Josos.
Javon Keys, TVJ News.
The Manchester police are reporting that murders in the parish are down compared to last year, but other crimes are trending upwards. The police plans to continue addressing murders and to reduce the other offences outlined as a new commanding officer was installed this week.
After approximately 20 months as head of the Manchester Police Division, Superintendent Gary Francis was on Monday replaced by Superintendent Lloyd Darby. At the installation ceremony on Monday, Superintendent Francis noted a 24% reduction in murders so far this year, listing killings as one of the main challenges.
Murder, shootings, and break-ins, which is really one of the big challenge in this parish, given that a number of citizens return here and they leave, go abroad, and their space sometimes broken into.
The JCF recent crime report indicates that between January 1 and July 20, 2021, 16 persons were murdered in Manchester. That is 5 fewer than the 21 killed over the same period of 2020. Superintendent Francis says the killings are as a result of disputes over property or relationships, and so dispute resolution has been his focus.
You know, as I depart this parish, I'll say something else about the poor management of dispute, that we really have not finished that job, but we have started that job. And I know that SP Darby will continue that job.
There has also been one less shooting incident in the parish compared to last year. However, there were 2 more reports of rape, 7 more robberies, and 12 more break-ins during the compared periods.
I am calling on the citizens of the parish to help us, partner with us, so that we regain our footing and we can have that crime reduction that we all want to make our parish a safer place.
Superintendent Darby also listed partnering with non-government organizations for crime fighting and structured traffic management for the parish capital, Mandeville. Herman Green, TVJ News.
State Minister in the Ministry of Local Government, Homer Davis, has announced plans to improve the country's water supply. Mr. Davis recently toured a renovated water recharge facility in Innswood, St. Catherine. Codian Barrett reports.
In keeping with the government's vision to ensure everyone in Jamaica can have easy access to potable water by 2030, State Minister Homer Davis announced that the government has been looking into new ways to generate water for the island.
If it means that we have to, based on NIC or WRA, whether or not we can extract 10 gallons from the Rio Cobre, then those are options that we have. But Rio Cobre is dependent on how regular we get our rainfall also. So you cannot extract beyond a certain capacity, because what you will do, you will destroy.
While touring the renovated water recharge facility in Innswood, St. Catherine, he explained how a system that replenishes wells can improve the parish's water supply.
This project extracts from the Rio Cobre some 5 million gallons of water per day. And it filters into this system here. And it filters through, and it goes through, and it goes to recharge the wells. These are wells that are situated along the plain of St. Catherine.
The facility, which was constructed in 2017 at a cost of $1.1 billion, was in poor condition and was later handed over to the Rural Water Supply Limited to be preserved and maintained to enhance quality of life for citizens. Managing Director of the Rural Water Supply Limited, Audrey Thompson, also pointed to other developments in light of the fact that the rain is the only source of water for some areas.
So we have been basically rehabilitating rainwater concrete catchment tanks, and in some areas where the Ministry of Local Government is setting up what you call water shops, yeah. Right? So basically we are trying to solve all of the problems as it comes to water to meet the 2030 vision.
A practice Mr. Davis is also encouraging other homeowners and developers to incorporate.
I think developers, in my opinion, should be looking at how they can look at every 100 houses or every 100 houses, you give them a storage capacity of, say, 50,000 gallons of water as a result of rainwater harvesting. And this is the way we have to go, right? We cannot ignore the fact that in Jamaica, some areas will have water for 6 months, and the other 6 months, they barely get any water.
Kodian Barrett, TVJ News.
A St. Elizabeth family is questioning how a relative who went to the Black River Hospital in the parish for a broken hip ended up with 3 other sores. The family is seeking redress from the hospital.
For the one know that they could send out a patient out of hospital in that state.
The husband of 74-year-old Emery Parchment bemoaning the condition his wife is now in following over 2 months in the Black River Hospital. He told TVJ News that his wife was taken to the hospital due to a broken hip. She was discharged from hospital, and when they arrived home, 3 other sores were found on her body, 1 in her back, under her foot, and on her ankle. The family is distraught.
So I don't know why they send her from Black River Hospital like that. She need a nurse care, not home care. When you send your patient to hospital, they should take care of them in the hospital, any hospital.
Her niece, Karen Williams, who visited Mrs. Parchment on a daily basis, spoke to the state she saw her in.
She had 2-gallon bottles filled with water hanging down to the floor, not touching the floor. So I guess they didn't notice that the sore was on the back until it get worse.
So that is where she was in the hospital?
She was on her back with the 2-gallon of water hanging down with attraction to the leg.
That was in a bid to have the broken hip reset. Ms. Williams says efforts were made to have Mrs. Parchment transferred to the Mandeville Regional Hospital in Manchester, but those efforts failed due to a lack of bed space. They are calling for members of a Black River Hospital to be reprimanded. But in the meantime,
they could come back for her because she needs dressing every day and better attention than what they give her when she down there. What kind of job they did that with her back still like that? They never look after her. No, they just pass through and look in her eye and they never even turn to say anything. Shake her if you even find, and go in time ready now then say home.
They say they are concerned because no antibiotics or other medication were prescribed to deal with the wounds. For Mr. Parchment, he does not see the need to go back to that hospital.
It don't make sense to contact Black River Hospital. It's going to be worse. If you come from there and you going to still contact her, talk down it. It don't make no sense.
O'Shane Masters. Meanwhile, in response, Black River Hospital says a number of issues were identified by the surgical team.
This was a lady that was extremely dehydrated. Her blood results on the day of admission actually revealed that she had a very, very low hemoglobin of 6, so she was severely anemic. In addition to that, there was some history of her having had a stroke some time ago and a history of Alzheimer's. She also came in almost what we call the fetal position, meaning that her lower limbs were contracted to her abdomen and she was hooked up pretty much. So she had severe contractures and so forth. So this was a lady that was extremely in poor condition, very, very poor condition.
Senior medical officer at the hospital, Dr. Sharif Imaru, says the family also knew about the bed sores.
As much as they try to prevent some of these things cannot be prevented. However, on discharge, it is not as if the relatives did not know that she had this. This was, they were spoken to about it. They were given referrals for dressings when she was being discharged, etc., etc. Right? So, to be honest, I'm really astonished that they actually approached TVJ for something like this when they could have easily just come back to us and stated what their concerns were.
And time now for the Business Minute. Here's Cody and Barrett.
Farmers and fisherfolk registered with the National Fishing Authority and RADA will now have access to a GK weather protection insurance policy. Agriculture Minister Floyd Green made the announcement in the House of Representatives on Wednesday.
It is a parametric policy, which means that once the tier is reached, the payout is automatic. There is no need for damage assessment. It's an automatic payout that will be given to the farmer once the trigger is reached.
Local businesses looking to take advantage of the opportunity to sell on the e-commerce platform Amazon are getting some help. Deputy CEO of the Jamaica Business Development Corporation, JBDC, Harold Davis, revealed that it's now looking to facilitate small businesses who are not ready to sell individually to do so through its listing.
Help is here. We are here to as a matter of fact, we are starting by doing a session with Curtin Barrington as early as next week for the entrepreneurs to just ventilate what this thing is about, make all entrepreneurs questions, you know what I mean? And what is needed for your business and your business structuring and that type of thing.
He was speaking during the Financial Gleaner and JNN Business Forum, The Exchange, on Wednesday. And that's it for the Business Minute. I'm Cody Ann Barrett.
Now for a look at the top regional and international stories. Here is Shamela Pullen.
In Trinidad and Tobago, children pose a greater risk of transmitting the COVID-19 virus and therefore must undergo 2 rounds of testing when traveling. The country's chief medical officer said children must have a PCR negative test before entering Trinidad and Tobago. They must also undergo another test between 3 and 5 days of entering the country. The CMO also disclosed there was a case of a 2-month-old baby being COVID-19 positive and treated in an intensive care unit. On the international scene, the death toll from severe flooding in China is over 33, with 8 people missing. Heavy rains have forced the Yellow River to overflow its banks, where more than 120,000 people have fled their homes. At least 12 died when floodwaters rushed into subway cars in the capital. State media said the train was stuck between 2 stations and some passengers waited for more than 3 hours to be rescued. And that's it for your international roundup. I'm Shamela Pullen.
And we head to a quick break. When we come back, we'll have our midday sports report. Renata Brown is standing by.
Welcome back. It's now time for your midday sports. Now we start with news from athletics. In an unprecedented scenario, President of the Jamaica Athletics Administrative Association, Garth Gale, will not be making the trip to Japan for the Tokyo Olympic Games. Now Simon Preston has that story.
TVJ Sports understands the track and field boss did not receive the accredited documentation from the Jamaica Olympic Association for the Games. Traditionally, presidents of the track and field governing body who make up the bulk of Jamaica's representation at the Games would be accredited to make the trip. However, when contacted this morning, Gale confirmed with TVJ Sports that he will not be traveling to Tokyo. When asked why, Gale noted that he will not comment of the reason until after the Games, as he wants all the attention to be on the athletes in Tokyo. Gale also declined to disclose the reason for his non-accreditation from the JOA, noting that only the umbrella body can give that answer. When TVJ Sports reached out to JOA CEO Ryan Foster for a comment, his phone went unanswered. We were told to communicate via text, but there has been no response to our queries. Impeccable sources, however, informed TVJ Sports that due to allowable numbers by the IOC, the JOA had only accredited 3 persons who were submitted by the J3As. Gale, however, was not among the trio, hence he was not accredited for the Games. Simon Preston reporting for TVJ Sports.
Thanks, Simon. And guess what? That's all the time we have for you with sports. So Shane, it's back over to you.
Thank you, Renato. And that's the midday news. I'm Shane Masters. Join us at 7 for primetime news on behalf of the news, sports, and production teams. Thank you so much for watching.